Diabetes is a chronic condition that occurs when the body is unable to produce enough insulin or effectively use the insulin it produces. Insulin is a hormone produced by the pancreas that helps regulate blood sugar, glucose, levels. There are two main types of diabetes, type 1 diabetes and type 2 diabetes, and each has different causes. Type 1 diabetes, autoimmune reaction. Type 1 diabetes is believed to result from an autoimmune reaction in which the immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. The exact cause of this autoimmune response is not fully understood, but genetic and environmental factors are thought to play a role. Type 2 diabetes, insulin resistance. Type 2 diabetes is more common and is characterized by insulin resistance, where the body's cells do not respond effectively to insulin. Over time, the pancreas may also lose its ability to produce enough insulin. The exact cause of insulin resistance is multifactorial, and several risk factors contribute to its development, including 1. Genetics. A family history of diabetes can increase the risk. 2. Obesity. Excess body weight, especially around the abdomen, is a significant risk factor. 3. Physical inactivity. Lack of regular physical activity can contribute to insulin resistance. 4. Age. The risk of type 2 diabetes increases with age, especially after the age of 45. 5. Unhealthy diet. Diets high in refined sugars, unhealthy fats, and low in fiber may contribute to the development of type 2 diabetes. 6. Ethnicity. Certain ethnic groups, such as African Americans, Hispanic Americans, and Native Americans, have a higher risk. 7. Gestational diabetes. During pregnancy, some women may develop gestational diabetes. This occurs when the body cannot produce enough insulin to meet the increased demands during pregnancy. It's important to note that while genetic factors play a role in both types of diabetes, lifestyle factors such as diet, physical activity, and weight management also significantly contribute to the risk of developing type 2 diabetes. Additionally, other forms of diabetes exist, including gestational diabetes and specific types of diabetes related to certain medical conditions or medications. Prediabetes can be seen as a warning sign. It's the body's way of saying that your insulin levels are rising. You can still prevent or delay type 2 diabetes by losing weight, even a modest amount, with the help of dietary changes, stress reduction, and physical activity. Taking medication can also help. And reversing the process is key because type 2 diabetes can be a devastating disease. The condition usually begins with insulin resistance, in which the fat, liver, and muscle cells do not use insulin properly. Eventually, the body needs more insulin than it can produce, causing blood glucose to rise. Those elevated levels can lead to serious health issues if they are not managed properly. You may not even know you have prediabetes or diabetes. You can be symptom-free for years. But once the complications of diabetes start to occur, nearly every aspect of your health can be affected. That's because the excessive sugar in your blood damages blood vessels and nerves throughout your body. Prediabetes is a condition in which blood sugar levels are higher than normal but not yet high enough to be diagnosed as type 2 diabetes. However, some individuals may exhibit signs that could indicate the presence of prediabetes. Common prediabetes symptoms include 1. Increased thirst, feeling unusually thirsty and needing to drink more fluids than usual. 2. Frequent urination, urinating more frequently, especially during the night. 3. Fatigue, feeling tired and lacking energy, even after getting enough rest. 4. Blurred vision, experiencing blurry vision or difficulty focusing. 5. Increased hunger, feeling hungrier than usual, even after eating. 6. Unexplained weight loss or gain, experiencing changes in weight without a clear reason. 7. Darkened skin, a condition known as acanthosis nigricans, where the skin around the neck, armpits, or other areas becomes darker. It's important to note that these symptoms can be subtle, and not everyone with prediabetes will experience them. Regular checkups with a healthcare provider and blood tests are crucial for diagnosing prediabetes. The following blood tests can diagnose the condition. The A1C test measures blood sugar over the past 2 to 3 months, and it's the easiest test since it's not necessary to fast beforehand. A result in the range of 5.7%-6.4% indicates prediabetes. Fasting blood sugar test measures blood sugar after an overnight fast. A result of 100 to 125 mg/dl indicates prediabetes. Glucose tolerance test measures blood sugar before and after drinking a glucose liquid. A result of 140 to 199 mg/dl indicates prediabetes. Anyone who is concerned should understand their glucose numbers and check them routinely. Lifestyle changes, such as adopting a healthy diet and increasing physical activity, can often help manage or even reverse prediabetes and prevent the progression to type 2 diabetes. Thank you for watching. Press the like button and subscribe for more content.